Hello, Dr. Montes. Hi. Sorry, can you hear me? It looks like you're mute. You're on mute.
Yes.
You're
Hi.
on. Hi.
How are you?
Good to see you again.
I just sent Paula the new link. Give me 1 second.
Okay, don't worry.
She's
Hi.
trying to get on, okay? Give me one second.
It's okay. How are you?
I'm good. How are you?
I'm good too. How's the COVID situation over there?
So where I live, it's been pretty quiet, thankfully.
Okay.
Really calmed down, thank goodness. How about you guys?
I think we are okay, pretty cool here as well. I think, yes, it's
Good.
fine. It's getting better.
Yeah, getting better.
Yeah. Okay,
For sure.
I think she's here.
I think Paula just popped on.
Hello. Hello. No, but you're on mute. Mute.
Okay, I'm unmuted. Can you see me and hear me?
I can see you loud.
Thank you so much.
See you clearly, very loud and clear. Wow, good to see you.
It's great to see you. Thank you so much for having me. And thank you, Dr. Jen.
Okay, so tonight is all about mastectomy. So
yes,
I have
is.
two powerful women here to help us with the discussion for that. So before we start, I think we all have to know a little bit about Perforate. And so I'm going to play a short video about Perforate, then we can kickstart. Are you ready? Okay, all right. Okay, just a minute. Pi, can we have the video of Perforate, please? Okay. So whilst we are waiting for the video, Dr. Florrie, nice to meet you. I think it's my first time seeing you. So as with Jennifer, we've met once last year. And how are you? Where do you live in the United States?
I live in New Jersey, in Princeton, New Jersey.
Okay. How is the COVID situation over there?
Things seem to be getting a lot better. A lot of people are vaccinated. People are getting their boosters. People who are not vaccinated are very compliant with masks and with distancing. And we seem to be on an upswing. Life is returning more to normal, and people's anxiety level is lower, and fewer people are getting sick.
Okay, good to know. All right, it looks like the video is taking a long time, so let me just introduce Perforate. Okay, I think we can have it.
I think
we have it.
It's on now. Okay, good. That's just a short video. So Perforate is an NGO, okay? An NGO which is aimed at bridging the gap between healthcare service and patients. And we believe that women, children, and the old age are the most vulnerable in our society. So we pay particular attention to them. And so women, children, and old age are at heart to us, okay? But we do organize extensive health programs targeted at all people generally in need of health care. This is why we have the vision of building an ultra-modern women and children center in Africa, Ghana to be precise, in Accra, to help healthcare with women and children. So we've even opened a GoFundMe account that we are soliciting for funds to try to help build this facility to help women and children back home in Africa. So that's basically about us. And so tonight we can start our discussion with mastectomy, but before we start, I think I have to introduce Dr. Mortis and Dr. Flory. Let me remind you that we are streaming live on Facebook and Instagram on our Instagram platforms. So that's just it. So I'll start with Dr. Montes. I hope I'm pronouncing the surname right.
You are.
Okay.
So I'm Dr.
So
Montes.
Dr. Montes is board certified general surgeon by the American Board of Surgery, specializing in diseases of the breast. She is a current and active member of the American Society of Breast Surgeons. She received her undergraduate at Cornell University and her master's in public health from Columbia University. She is a strong believer in treating the patient as a whole, body, mind, and spirit. She is also the director of Evolve Pink. She is a mommy, a wife, a farm animal sanctuary owner, and a lover of life and love. I love that part. Okay. Dr. Moses, do you have anything to add, anything to tell us about Evolve Pink? Anything, something small to add to your profile? Anything to say?
Sorry, Nellie, you broke up. What was that?
Do you have anything to add up to your profile or anything to say about Evolve Pink?
So I think that was pretty much me in a nutshell.
Okay.
Evolve Pink is busy right now. We're just helping women make the transition between treatment and healing after their treatment. We offer all kinds of stuff. We can put up my web page later for women to look at.
Okay.
Yeah.
I think we have a short video of Evolve Pink, which we are going to play after the introduction of Paula, if you don't mind.
Sure.
Okay, good. So let me take Paula. So Dr. Paula Flory, I hope I'm doing it right, pronouncing it right. So Dr. Flory is the founder and executive director of Move Over Breast Cancer. I love the name. A nonprofit providing helpful and healing experiences for individuals touched by breast cancer. Paula holds a BA in psychology from Lehigh University and an MA in counseling psychology from New York University. In her early career, she worked in the New York foster care system and later as a counselor working with women with addictions and eating disorders. Dr. Flory is also a certified personal trainer. In fact, I have to see you after this, and a group exercise instructor. After her diagnosis of stage 3 breast cancer, wow, in 2011, she discovered that her true calling in life was to assist women affected by cancer. God bless you for that. She worked for a local breast cancer nonprofit for many years, was invited to speak at various national and international conferences focused on breast cancer survivorship. And in 2019, was named Breast Cancer Leader of the Year by Breast Cancer Wellness Magazine and Bare Necessities Power Figure in October 2020. Wow, Dr. Flory, nice to meet you.
Nice to meet you too. Well, first of all, I have to make one small but big correction. I'm not a doctor.
Okay.
I would love to be a doctor, but I don't have that esteemed title.
Wow.
So I am a lay person, but everything you said, is me in a nutshell. I did have a stage 3 breast cancer in 2011, which I did find myself. It was not detected on a mammogram. So, by the grace of God, I live to tell my story. And it's my privilege now to be able to mentor other women who are facing all of the different challenges that come with a breast cancer diagnosis.
Okay, so do you mind if I call you Paula then?
That's absolutely fine.
Okay, all right, please, Pipe, can we have the video of Evolve Pink? I love the name. Dr. Montes, how did you get the name Evolve Pink?
Oh, how'd we get the name, Paula? It evolved.
It was an evolution.
It was an evolution.
Okay, let's take it. Okay, we are ready.
I am a general surgeon by training, and I specialize in diseases of the breast. I knew very early on in my medical career that the treatment of breast cancer was my true calling and passion. You quickly realize in the treatment of this disease how much this diagnosis affects a woman on many, many levels. Not just her health, but her self-identity, her family, and it's all those moving pieces and components that made me realize not only do I want to treat this disease, but I also want to create something that helps women after their treatment is finished. Women with breast cancer who come to the conclusion of their treatment feel lost because this entire network of healthcare providers and support that were surrounding them has come to an end. That's the piece that Evolve Pink strives to fill, the gap between treatment and the transition into healing, and to give her the tools necessary to transform that into the catalyst for self-empowerment and their greatness. Evolve Pink is bringing women together in a multitude of ways. In-person support group meetups, space where women can come, commune, network. In our mobile units, we're going to women so that they don't have to travel far. We are meeting women virtually online so that our reach is global. We have navigators that help women and meet them wherever they are in their journey. We've been offering Reiki, acupuncture, guided meditation, massage, yoga, exercise series, healing arts, guest speakers, nutritional series, book clubs. Every woman can find something that they relate to and will incorporate into their life. And it's those holistic modalities that help women gather themselves back together and feel as whole and complete as possible. Sometimes it's just enough to come to a place and be able to have a cup of coffee with somebody and not necessarily even talk about your experience, but know that they've been there. And to help other women who are new to this process, I want to thank everyone who's contributed to making Evolve Pink a reality and for allowing us the privilege of helping women throughout their breast cancer journey. Without you, we couldn't do what we do, and we thank you for joining us on this mission.
Oh, Evolve Pink. Okay. Oh, that's good. Good to know. And so how is it going so far?
It's going well.
Yeah.
It was an interesting time, like you guys know, to launch something like this in March of 2020. But with the new emerging ways to communicate with people, I met you guys all the way in Ghana. We've connected with women all over the world.
Yeah.
So it was difficult, but it was almost a happy surprise because my original goal was really very local in my town and kind of the surrounding town. And now it's kind of had a farther reach. And we've been able really to bring professionals in to help from far away also, and just build community so that women know that they're not alone even in their town, but they're not alone in the world. This is a problem that affects women everywhere. And it's just been beautiful to watch.
Okay. We are also happy, in fact, we are happy to have you on board. I mean, collaborating with you. And then we are so happy because you're touching a lot of lives, especially women. And we are grateful for this opportunity. And we hope to work with you in the future as well. And let's see how best we can see. And we'll be happy to see you in Ghana as well. Okay?
I'd love that. So Paula actually has been to Africa on missions to teach about breast cancer awareness. And she has her own nonprofit called Move Over Breast Cancer. Paula, do you want to talk about that?
Yes, if you want to. Yes, the Move Over. Can you tell us a little bit about that?
Sure. So similar to Dr. Montez's mission, we're really just trying to reach as many women as possible who are going through breast cancer, from diagnosis through treatment and into the realm of being a thriver afterwards. We're just really focused on trying to connect women together, but also to provide them with concrete programs and services that help them with each and every stage and phase of their journey. And with Move Over Breast Cancer, I decided actually before the pandemic that what I really wanted to do was to be able to bring the services directly to women in a vehicle that was basically a roaming support vehicle. And so I have a large van, a walk-in van that I've converted into a resource center, basically. And so it just brings a hopeful moment, even if it's just for a moment, to women, because it kind of looks, somebody told me today, it looks like a Barbie camper van inside. So it's actually just like a flash of light and bright inside of this dark journey. And although it seems sort of whimsical and fun, what we provide is actually some very serious and important services that include counseling. And we have collaborators throughout the community and beyond who can help with things like Reiki and oncology massage and other types of treatment modalities, complementary treatments. And it's been a great journey so far. And we say that it's support at your doorstep. So for women who feel as though they cannot come out because they still have fear of exposure to COVID, or if their immune systems are compromised because they're in treatment, it's really wonderful to be able to go directly to them and to provide the services. And we do things like head shavings also, and wig fittings, and everything is completely free of charge.
Oh.
And so it's been a great journey so far. It took some time to get the organization off the ground, but I did get the vehicle in June. So in these past months, the organization's really taken off. And unfortunately, there's enough breast cancer to go around. So there are plenty of opportunities to connect with women and help them.
Okay, I love the van idea. Wow, very impressive. Well done.
Thank you. Thank you. It's been fun.
Okay. All right. So let's dive right into mastectomy. Dr. Montez, please. What is mastectomy? Let's start with that.
So mastectomy is one of the options, one of the surgical options to deal with a breast cancer diagnosis. Oftentimes, we use that when there's a lot of breast cancer in the breast, or when women have a genetic predisposition for breast cancer, like we talked about our last session, because they have a higher risk of making another breast cancer in the future in the same breast or the other breast. And that's when that kind of comes into play. We also use mastectomy in communities where radiation therapy afterwards isn't really available or an option yet.
Okay.
And that's pretty much it. So a mastectomy is the removal of all of the breast tissue, leaving the skin overlying.
Okay.
And there's oftentimes reconstruction, and reconstruction now, creating a new breast, has become really an art form. It's not like it used to be. We're not leaving women deformed like we used to. It's become an art form. And my goal with my patients is primarily, obviously, to make them cancer-free, but second, very closely to that, is to leave them feeling and looking in a way that they feel comfortable in their own skin and in their own body after.
Okay, can you tell us the types that we have?
So there's different types. So there's simple mastectomy, meaning the removal of the breast tissue with no reconstruction. There's the classic mastectomy with reconstruction, which means an incision across where the breast would be with the implant or tissue beneath. And now we're actually performing what's called nipple sparing mastectomy, where we spare the nipple and the skin and the reconstruction is done underneath. So those are the three different types. We don't do radical mastectomies anymore like we used to in the past with the removal of the muscle or anything as radical as that anymore, because what we've learned is that it wasn't really helping women. We weren't helping recurrence rate, we weren't helping survival rate, and we were causing a lot of deformities and complications afterwards in terms of muscle weakness, arm injury, swelling. So that's kind of a thing of the way distant surgical past.
Okay. All right. So who decides the best type of mastectomy to have? Is it the doctor, the patient, or you have sort of a counseling section, or how do you decide which of the types to have?
Which type of mastectomy?
Yes.
Well, really the decision is whether or not to have mastectomy or breast conservation, the lumpectomy, right?
Okay.
And that's a decision that we make based on the amount of breast cancer that there is, the patient's genetics and personal risk, and also the patient's choice. I believe that everybody has sovereignty over their body, and sometimes oftentimes it's not medically necessary to have a mastectomy.
Okay.
But if the patient chooses that that's the best thing for them in terms of risk reduction or managing how they want to move forward in terms of their breast screening and managing their quality of life in terms of anxiety or the possibility of it coming back, that's a conversation. And at the end of the day, as long as it's medically safe, it's the patient's decision that we make together.
Okay. Paula, please, do you have people who are about to have mastectomy on board on your group, or is after the whole surgery that they come on board?
Both. I receive a lot of phone calls and inquiries from women who are very newly diagnosed.
Okay.
Like that day, the day of diagnosis, when they really are feeling like they're in crisis and don't know where to turn. So the process will begin there. And with my organization, Move Over Breast Cancer, what we do is provide them with whatever they need at the time that they need it, and that could change. So on the day of diagnosis, what women really need is they need assistance with helping them to breathe and to process this information, and maybe help with navigating, what doctor do I see first? What kinds of questions do I ask? And then the needs will change as she progresses through all of the different interventions that will happen, whether it's mastectomy or lumpectomy, or whether they'll need chemotherapy or not. So it really changes over time. So I see people at all parts of the journey, including women who are 10, 15-year survivors who are still having some issues of self-esteem, or they never really were able to heal emotionally from what they went through from being diagnosed with breast cancer.
Okay, so when they come, when they have the first diagnosis and they come to you, how do you receive them? What exactly do you do for them?
Normally what will happen is a phone call happens first, and I really will typically have a 30-minute to 60-minute telephone conversation, really just listening and being there and receiving whatever it is they need to get out, and then helping them to just take the first step in order to be able to sleep that night, basically, because it's so traumatic. And I know how that feels, because I remember, even though it was now 10 and a half years ago, I can remember every nuance of the telephone conversation that I had with the doctor that delivered the news to me. And the way that it was delivered to me was traumatic. I was at work, I was by myself. So I know that many women feel that way and are diagnosed in that way, that can be very shocking and impersonal, and very traumatic to the entire body. So I am able to be very empathetic and compassionate. And sometimes it gives me a little bit of post-traumatic stress to even hear it, because I know so profoundly what it feels like. So, but I think that's comforting to people, because when I say I get it, I really do get it.
Oh, God bless you for that. Okay,
Thank you.
Back to Dr. Montes. Dr. Montes, what are the risks of mastectomy? Are there any risk?
So the risks of mastectomy are pretty much similar to most surgeries. The two biggest risks are bleeding and infection. The risk of infection goes up with certain factors of having to do with the patient. If they're a smoker, the risk of infection goes up. If they're obese, if they're diabetic. And there's always a slight increase of infection when we're introducing any foreign object into the body, like an expander or an implant. But with preoperative antibiotics and the amount of care that we give now, that's quite rare. But those are pretty much the risk. There's also the risk of nerve damage, of lymphedema, meaning arm or breast swelling afterwards. There's always some loss of sensation of the skin overlying the chest wall.
Okay.
And for me, I consider also the psychological risk components. It's a big change for women. It's a big surgery, and it affects them on many different levels. So for me, for surgeons, it's easy to just focus on infection and bleeding, but that's really not the only thing that impacts women with a breast cancer diagnosis or the choice of doing mastectomy with or without reconstruction. And that's why I think women like Paula are so important to the care of women, because that's part of what I want my patients to understand, that there are those components from the get-go so that we can start working on that from the beginning.
Okay. Okay. And so, Paula, psychologically, are there steps you take or you put patients through, you take them through, aside talking to them? Do you have any specific things that you do to help people?
Yes and no. It really depends upon the woman. Some women feel tremendous relief in knowing that they're going to have a mastectomy.
Okay.
And because they just want the cancer gone. And that is often something that I think that, Dr. Montes could probably speak to this as well, that people say, just take them, just get rid of the cancer. I just want it to be gone. But that may and often does quickly change after mastectomy, when for the first time you see yourself without breasts and you realize that it's an amputation. It is it's very traumatic to the body mechanically, to no longer, especially if women are big breasted, to no longer have breasts, but it feels different and it can be traumatic emotionally and psychologically. So I typically will talk with women about that. Yes, we do want the cancer gone. And yes, that is the most important thing, is that our lives are saved. However, we also need to process this information that we are going to look different. We will feel different as women. Our clothing will fit us differently. So I like to let women, when they're ready, but before their surgery, think about those things so that it is not so terribly shocking the first time they look at themselves without clothes on.
I can just imagine that. Wow. Anyway, are there any side effects after mastectomy?
So side effects, I think we've kind of covered that.
That's the bleeding and then the infection, right? Okay.
Right. So we think about the changes to the skin sensation. We always are very clear and upfront about the risk of lymphedema to the arm, especially when lymph nodes are taken. And it's something that we watch for very closely. That means swelling of the arm, so that if that starts, we're able to get ahead of it very quickly with sleeves and physical therapy and lymphatic drainage massage and things like that. I do a lot of education about lymphedema post-mastectomy.
Okay.
And the biggest thing is really the avoidance of any infection to that arm. We talk a lot about not having blood drawn from there, or vaccines placed, or blood pressure. But when you really dig into the data, the biggest component that we can control for reducing the risk of lymphedema is infection. So women who get their nails done or who live in rural areas, I talk to them about hygiene of the places they get their nails done, never picking at mosquito bites or itching
Okay.
bug bites, or if they have a cut, to be cognizant of putting Neosporin on them, things like that.
Okay. All right, let's go into treatment. Can you tell me about the treatment procedure? How do you treat after the surgery is done? What
So
do you do? Yes.
the treatment after mastectomy depends on really the kind of breast cancer that the patient has. So
Okay.
there's lots of different types of breast cancer, and we've talked about that. Some require chemotherapy regardless of lymph node status, right? Even if there's no lymph nodes any disease in the lymph nodes, because of the type it is, it's more aggressive. We give them chemotherapy. Those are women with what's called triple negative breast cancers or HER2 positive breast cancers.
Okay.
If they have what's called a hormone positive breast cancer, which is the most common, that really typically is based on whether or not the lymph nodes are involved. And here in the States, we use something called the Oncotype test, which is a special test we do on the tumor itself that gives us a pretty clear answer of whether or not there's any benefit to chemotherapy afterwards. Another common therapy after mastectomy is radiation. Radiation isn't common after mastectomy. The only time that we use radiation is if those lymph nodes are involved, or if there's extensive disease that has involved the chest wall or close margins to the skin.
Wow. But is there any type of that one? I would go to Paula. Paula, so yours, I don't want to remind you of the past.
No, it's okay. I'm perfectly comfortable answering and addressing any questions about my own personal experience as well.
Okay, thank you. So with your stage 3, how was the treatment for you? How was the treatment procedure? Yes.
I had a mastectomy. I had a full axillary node dissection, which means that all of the lymph nodes under my arm were removed. My breast cancer actually did present itself to me with a lymph node under my arm. So I knew that there was something wrong. Even though I had had a mammogram and it didn't see anything, I knew that I had something happening because there was a lump under my arm. So we knew very early on that I had some lymph node involvement. The extent of it, we didn't know until, we went through all of the different imaging tests and biopsies and that sort of thing. So I had the mastectomy and the full axillary node dissection, which was then followed by radiation. I did have to have radiation as well because of the extensive lymph node involvement, and also because I had some lymph nodes that were high up, which I think, I don't know, Dr. Montez could speak to this because I'm not a doctor, but I think it means that it's just a more extensive or a type of breast cancer. And I had a hormone receptor positive breast cancer, which is the most common type and the slowest growing type. And so I did have to have, after mastectomy, chemotherapy, radiation, and then follow up for the past, for 8+ years, I took a hormone blocker, basically, medication.
Wow, for 8
So
years.
I had it all. Yes.
Wow. And which of the types of mastectomy did you have? Which of the types?
So I don't know I did not have nipple sparing mastectomy or skin sparing, but I did have an expander placed in that area for reconstruction. And I did have breast reconstruction done as well. And that's also a very long process, but I did not have a bilateral mastectomy. I had just one breast removed, and that was what the recommendation was by my breast surgeon. And it was also a personal choice. Some women would choose to do bilateral, just because of this notion that if my breasts are gone, breast cancer will never happen to me again. And I chose to do it because I wanted to hang on to one breast. To me, it was important. And I knew that it was not going to increase my risk of recurrence. That breast cancer I did not have the genetic mutation. That was something that I think that's one of the things that the surgeons look at before they help a patient make a decision. If I had had that genetic mutation, I would have gone ahead and done bilateral, but I decided to just do one. And some women also do a bilateral or make the decision to do that because of symmetry when they get their reconstruction done. So it tends to look better if you have both breasts reconstructed at the same time, just for balance in your body.
Okay, thanks for sharing. Dr. Martis, that brings me to my question. If someone doesn't have any genetics, like generally you don't have any genetics, your mom, your dad, any member of your family did not have history of cancer, how do they end up getting cancer? Is it because of our lifestyle? Is it the food we eat? What are we doing wrong? I mean, is there something we are not doing right as women?
So this is something, and we talked about this a little bit last time, that I really hone in on. 85% of the breast cancers we see do not have family history and do not have a genetic component. So they're sporadic, meaning by chance, bad luck. But to answer your question, I don't think that breast cancers happen just by bad luck. I think it has to do, we're never going to know why it happens in a particular person.
Okay.
I'm never going to be able to look at Paula and say, this happened because of this thing that happened in your past, because I don't think it's like that. It's not a one-to-one cause root relationship to the diagnosis.
Okay.
I think it's a combination of our biology, our genes. I think that there's genes that we haven't even discovered yet that are at play here. And yes, certainly things that we're exposed to in our environment, and as far as the foods that we eat, pesticides that we are exposed to, toxins we're exposed to, things in the air. It's difficult to point out causality, but I do believe that that has a lot to do with why we're seeing an increased rate of breast cancer. And it might be anecdotal. Some people tell me that, but I am noticing that I am diagnosing women that are younger and younger. And this might have to do with more education, awareness, and better screening. But, 15 years ago, when I started my journey of becoming a breast cancer surgeon, I don't remember many 30, 40-year-olds that we were treating. And now I see that quite often.
Wow.
Yeah, sadly. So certainly there's components in our environment and things that we're exposed to that I think are contributing to this. And that's why screening, paying attention to our family history, paying attention to our genetics, paying attention to what we eat and what we expose ourselves to is so important.
Okay. All right. So another question. So when you take off let's say one breast after mastectomy, do you have the likelihood of the cancer spreading to the other side?
So
what are your chances?
So before I perform a mastectomy on a patient, we screen them very closely for anything else going on in the other breast by imaging, MRI, sometimes other biopsies, to make sure that when I'm going to the operating room, I know that I'm going for everything that I could possibly be going for at that moment. Having a personal history of breast cancer does increase your risk of making another one in the future, but there's nothing to say that if you choose to have a single mastectomy like Paula did, that the other sister breast is ever going to misbehave, because the risk of forming a breast cancer in that breast is relatively the same as anybody else in the population. And that said, if God forbid you were to make a breast cancer in that breast, there's nothing to say that that's going to impact your survival rate, the chance of that breast cancer causing your death, because it would be caught, it would be treated, and hopefully cured just like the one on the other side was.
Wow.
Right. And I do get screened on the other side. Obviously, I get a diagnostic mammogram every year and my clinical breast exams. And I am very aware of any changes in my breast. So I think that especially now that the technology is so much better with these studies that we have with mammography screening and diagnostic mammograms, I feel as though if it were to happen to me again, that it would be caught earlier than it was the first time.
Okay, Paula. So let me just ask, medically now we don't have the causes of breast cancer, as Dr. Montes said. Medically, it's not proven. But when you look back 10 years ago, do you think there's something you didn't do right, something you were not doing right that made you had cancer? Or, I mean, right now you have the experience. So as you said, if anything shows up, you're able to identify it as quick as possible. But in the past, do you think you did something wrong? Do you think there was a lifestyle you were living that caused it?
The quick answer is no.
Okay.
I believe that I had a very healthy lifestyle. I always exercised and ate right, but that doesn't necessarily mean that I was not exposed to environmental toxins and, you know, additives in food and in the environment and in the air that we breathe that may have had some effect on the way in which my body was able to or not able to stave off, you know, the growth of breast cancer. So, you know, on the surface, it's not as though I could say, you know, there are certain links, like people who drink a lot of alcohol or people who are obese, you know, they tend to have higher rates of breast cancer, but I didn't have any of those things. And as a support person, you know, in the world of breast cancer support, I'm very, very cognizant of the fact that women do believe and always question, what did I do to make this happen? And I think it's so important for us not to blame ourselves for getting cancer. And I feel that that can be very damaging to a woman as she goes forward, to believe that she did it to herself. You know, this, as Dr. Montes said, you know, it's a random thing that happens most of the time if you don't have that genetic predisposition. And I feel that women can become better thrivers if they don't hang on to this notion that they did something wrong. And if they do feel that they did, now it's time to do something right. So if you were a person who ate a lot of sugar and never, you know, took walks or, you know, stayed in toxic relationships with others or, you know, all of these various things that we think can affect our predisposition to getting breast cancer, you know, now's the time to make a change. So, you know, let this be the trigger for a healthier life.
Yes, I'm making a change. Okay. Okay, that's good. Okay, Dr. Montes, let's talk about recovery. So after mastectomy, what's the recovery? How long does it take one to recover?
So my patients are up and walking that same day. Absolutely. If they're not up and walking, something's wrong.
Okay.
The first week is tough. That'll be the toughest. They'll be sore, but I have never had a patient call me in the middle of the night saying they have intractable pain. We're very good at pain control. We're very good at doing nerve blocks before the procedure. A lot of my patients aren't even really requiring opioids at this point. We get them through kind of just with Tylenol and some relaxants. It takes, I would say, about 6 to 8 weeks to be 100% back to, you know, your baseline self. But by the second week, when the surgical drains are starting to come out and getting more mobile, most of my patients are doing pretty good. I think Paula would be better to speak to this because she's, you know, gone through it herself.
Yes, Paula, how was it like for you?
For me personally, and I tell women this all the time, it's really not that bad. It's just the psychological effect of it and the emotional impact was so much worse for me than the physical pain of mastectomy. You know, and I did have that full axillary node dissection, so it was uncomfortable in my underarm area for a while, and it still doesn't feel normal. It'll never feel normal again. Like you always just have these weird sensations. But in terms of pain, I think it's probably so much worse to have like a knee replacement or something like, or your gallbladder removed or something like that, some kind of abdominal surgery. It really is not that painful. I was running circles around that hospital begging to go home after one night. They said, you have to stay a second night because whatever their reason was, but I felt like I could go home. And my friends came to visit me, and I just tucked my drains into my pockets and went out for a coffee with them 3 days later. So I was fine. But I think that with the women that I work with, generally, what Dr. Montez said is correct. It's like a week. The first week is tough, but by week 2, you're starting to feel normal. And in a month, you're back to normal.
Oh, okay. So how long did it take you to start doing your normal activities, your normal duties, like driving and stuff like that? How long did it take you?
Once I no longer had drains, so that was about 2 weeks. I was back to, driving my kids around and doing that sort of thing. Full exercise, I can't remember exactly, but see, for me, I went straight from mastectomy into chemotherapy. So it kind of is still, my memory is not 100% in terms of the types of activities I was able to do, because I then had a whole new set of things to deal with going into chemotherapy and having those physical side effects. But in terms of mastectomy, without having to go to chemotherapy, I think within a month you would be, up and running for sure.
Okay. All right. Let me just remind all those here that if you have any questions that you want to ask, please, you can just raise your hand up so that I will call you for you to ask Dr. Montes any question, and Paula as well. If you have any questions regarding her journey, you can ask her. She's here to help you. They are all here to help you. So, all right. So that's it with the, yeah.
I think the topic of today's thing was mastectomy does not define me.
We are
And I
coming
think
to
that is, we are okay.
Yes, because I wanted people to know generally what mastectomy is all about, because we can't just dive into it without people knowing. Okay, so let's go to that. It did not define me. Paula, did it define you?
It did not define me, although I have to say that probably for a short period of time after mastectomy, it's difficult to think about anything else besides the fact that you have cancer. It's a full-time job. So you may have an additional full-time job. You may work in an office, or you may be a doctor or a lawyer, or, an office cleaner or whatever. You still are a cancer patient, and that takes a lot of time and focus. You are required to go to so many different doctor's appointments and to the hospital if you're having any kind of follow-up systemic therapy like chemotherapy. And so, unfortunately for me, it did define me for a short period of time. But I think that I was able to really overcome that over time. And which is why part of the reason why I do the work I do now is so that I can help women to understand that there are things that they can do to navigate this journey in a better way than I did. To like I said, like I referred to earlier, like looking at your body and knowing that you're going to look and feel different after the surgery. I think that's really important to address. It's important to address in your relationship. If you're in a relationship with, if you're married or have an intimate relationship with someone, I mean, that is extremely important to address early on. And, whether or not you have reconstruction, that's a whole, those are two different types of situations that you'd have to deal with. So for me, it was really an evolution and a journey to getting to the point where mastectomy didn't define me, that being a cancer patient didn't define me. It all goes together, because if you have a bald head and you have no breasts, it's very difficult to define yourself any other way than as a cancer patient. It takes a lot of work, inner work, and support from other people who have been through it to help you to understand that you can still be a strong, beautiful, attractive woman without breasts.
That's a difficult one.
It is a very difficult one.
Dr. Montes, you being a doctor or you being the surgeon, I mean, with people that you diagnose every day, how is it like for them in terms of definition? How do they define? Obviously, it's it's
Yeah.
very difficult for women to be diagnosed. So how is it like for you? Yes, being a
It's
doctor.
very difficult, yes, and it's scary. And part of what's so scary is the unknown, because a lot of my patients, I see them, I see their diagnosis, I know what their pathology means. Nothing is guaranteed, but for the most part, from their workup, I'll know how they're going to do. And the grand majority of women do quite well. So
Okay.
part of my job is to be able to relate that in a way that gives them the information they need and hope, without ever giving really any false hopes or feeling or having them feel like I'm lying to them, because I will never lie. And the second piece is, as far as defining you, a breast cancer diagnosis, your treatment course, and everything that goes along with it is always going to be a part of you. It's always going to be a piece of your story. It's always going to be incorporated in how you see the rest of the world going forward forever. But it doesn't mean it has to define the way that you see yourself and define the way that you approach everything else. So that's part of the work that Paula and I do with Move Over Breast Cancer and Evolve Pink, is to give women those tools to start processing through that time in their life in a way that's healthy and in a way that they can incorporate it and put it where it belongs in their life, and then move forward with their life in a way that it's not a hindrance. It's not something that they're constantly mulling over and in fear of, but really something that they went through and persevered through, and is it's proof of how strong and amazing they are. So that's kind of how I see breast cancer as defining women, is that how strong they are.
Okay, but don't you think it's difficult to process this whole thing, even from diagnosis, from being diagnosed? And I'm sure it'll be very heavy on everyone. So initially, I'm sure it'll be very tough, but I'm sure with counseling and, as you said, psychologically, and the love, being close to loved ones, being close to people who have experienced before, like Paula, I think it's kind of easy to manage through things, rather than you being alone or being all by yourself. Yes,
absolutely. The community, the support, all of that. And that's part of what we're trying to create, is a network of women who can gain through it, during it, and then come out the other side, women who can then reach backwards and help women through their journey.
Right.
Okay. All right. I think a few people have questions. Instinctive wave, since you are here, Paolo is here, Dr. Montes is here. Please, if you can hear me, you can unmute and ask your question. Instinctive wave, are you there? Can you hear me, please? Okay. I think he wrote something here. He said, how long will surgery take? How long will the surgery take if you're having a mastectomy?
So it depends on whether you're having one side or two. If you're having a bilateral mastectomy, on average, it's about 2.5 to 3 hours or so.
Okay. So, Dr. Montes, do you normally have a team that you do together? Do you have a team of doctors?
I do have a team that I work with. I have a physician assistant, and I have Dr. Ibrahim, who's my plastic surgeon partner that does all of my reconstructions, and we work together as a very close-knit team.
Okay, someone said I should ask this. Amasewa Frimpon says that, please, I would like to know if there's a link between breastfeeding and breast cancer. If there is, kindly throw more light on it. Thank you.
So breastfeeding has been shown to be protective, and the longer that you breastfeed, the more protective it is. The most risk reduction we see is in women who breastfeed for at least 1.5 to 2 years, which is a long time to breastfeed, but that's where we see the most benefit, is women who breastfeed for that period of time.
Okay, all right. Paula, she also has a question for you. How did your family embrace you, your new life after mastectomy? Yes.
So, that's kind of a complicated question. So I have two children and they were teenagers at the time. And so they were obviously afraid, but they took their lead from me. So if I presented as a strong person who was okay, they knew that I would be okay. But I still think for them, it had less to do with mastectomy and how I looked and more to do with, am I going to lose my mother before I am an adult? So they were afraid. So I don't think that they had any reaction to the way that I looked. It was really just the way that I acted. And for my husband, who, we'd been married at the time, almost 25 years at the time. So we'd been together a very long time. So he was also extremely afraid. And on the surface, did not care. And not on the surface, truly in his heart, he did not care at all how I looked. He also wanted me to be alive and to live out the rest of our lives together. But as I began to heal and things began to become more normal in our lives, when I was no longer an active cancer patient, he was extremely proud of the person that I became. But I do have to say that it was an adjustment for both of us to process the fact that I no longer had normal breasts, that I had been missing a breast, that I went through this process of reconstruction. I saw somebody asked a question, if you have immediate reconstruction, how will your breast look? If you have a good plastic surgeon, they look good, but they're never going to look like a real breast. I mean, you have to understand that you will never be the person you were before, but that's not always a bad thing. Okay. It can be a very positive thing. For me, it turned out to be a very positive thing, but that's not to say that it wasn't a very rocky roller coaster ride from the point of me being diagnosed with breast cancer and having a mastectomy to the point I am now, 10 and a half years later. Okay. It was a process. And I was searching for a long time for the restoration of who I felt like before. And until I realized that I wouldn't be that woman anymore, but that I could be someone different, someone who may look different and feel different, but who might be better in a lot of ways. And so once I came to that point, my husband was also able to get there with me. But it was a lot. It was a lot of frustration on his part for me feeling like I had to hide from him, that because I didn't like the way my breasts looked, I kept wanting, a different surgery, a different type of reconstruction. I didn't feel like the attractive woman that I was before. But I, over time, realized that because of what I went through, not in spite of, but because of what I went through, I actually was more beautiful. And I think once I came to that, he was right there with me. But it is a journey, and it's not an easy one for everyone.
Okay. To Paula again. So Dalek says that, do you have young female athletes in your camp? How do they dwell in sporting activities with their mates? How do they do that?
Yes. So young female athletes. So I have athletic females who are, so they may not be athletes per se. They may not be collegiate athletes, or certainly I don't work with any professional athletes, but I work with women who are athletic, and I was athletic prior to my diagnosis. And so we do sporting type of activities together.
Okay.
Things like hiking and walking, different types of fitness dance. And we do those types of group activities, and also, one-on-one training activities with weightlifting. Once, obviously, your doctor needs to clear you to do these types of things,
Okay.
but it's a great support network and a bonding experience for women to do these activities together, because sometimes after the treatment and diagnosis, you become weaker. A lot of women gain weight during chemotherapy. And you're just feeling like you need to, do something to make yourself feel and look better. And so what a great way to bond, because you're also reducing your risk of recurrence by exercising.
Okay. Dr. Martin, are you there, please? Do you have, this is a personal question, I don't know. Do you have pictures of before mastectomy and after mastectomy pictures that you can show us how the breast looks like after?
I have them at my office. I don't have them here at home on my phone, but I can share those with you.
Okay. All right. Someone said I should ask you, what are the mitigating factors you can recommend?
What are what? I'm sorry?
Mitigating factors that you can recommend.
Negating factors?
Mitigating factors. Mitigating. So things that
reduce your risk?
Yes, exactly.
So exercise is very important.
Women specific exercises we have to do? Just specific ones?
Nope. Just
general.
Elevating your heart rate for over 30 minutes a day, 5 times a week, reduces your risk of breast cancer by 15%.
I've been joking a lot. Yes. Okay.
Obesity is a big factor. Women who are obese have a significantly higher risk of breast cancer. So watching what we eat, exercising, things like that are very important. Reducing the amount of alcohol we drink. Women who drink more than 5 alcoholic beverages a week have a much higher risk of breast cancer than women who don't. So those 3 things are the 3 things I tell my women they can control: their diet, how much they exercise, and what they consume in terms of food and alcohol. And of course, always getting your screenings and doing self-checks.
Okay.
And don't smoke. Don't smoke.
Yeah, don't smoke.
No smoking. No smoking. Okay. Dr. Martis, what about food? Are we supposed to eat specific food, vegetables, fruits, specific ones, or generally?
So generally, I tell people to try and eliminate processed foods as much as you can. When you read a label and you can't say the words on that label, I try to avoid as much. I mean, once in a while you're going to eat an Oreo, but you try to avoid foods that are highly processed and have ingredients in them that we can't even pronounce, because if you can't pronounce it, you definitely don't know what it is or where it came from, right? So fruits and vegetables, leafy greens, lean meats. I'm a big person on knowing where your meat comes from, at least trying to know that they're not coming from big, gross factory farms where they're pumped full of antibiotics and drugs and things like that. So healthy fats, lots of vegetables, and clean meats.
Okay, so a mastectomy did not define me. Let's talk about confidence. How do you get your confidence back as a woman? You know, I'm pretty sure that after surgery, when you look at your chest and you don't see it anymore, I mean, you're going to lose your confidence. Psychologically, it's going to affect you, as you've all said. So what are some of the things you have to do in order to get your confidence back as a woman?
For women who do not get breast reconstruction and choose to be flat, either on one side or both sides, or are forced to be flat because of some situation that precludes them from having breast reconstruction, I think that if they want to restore their feminine form, they could wear breast forms inside of a mastectomy bra. And that's something that I do very frequently, is fit women for mastectomy bras and breast forms so that they can wear clothing the way that they did before. And so on the outside, nobody would ever know. And I think that that is really very, very important for a lot of women. And especially if you have a unilateral mastectomy, mastectomy, if you just have one breast removed. I think it's important for women to be fitted for a breast form on the other side. It's really difficult to wear clothing if you don't, A, and B, I think that, it causes an imbalance in the way that you walk and, move your body. So that's definitely one thing that you can do. But you can also restore your confidence and in ways that are not necessarily focused on your breasts. You need to work on the whole person. It's not just about your breasts and losing your breasts. At some point in time, we grow older anyway, and we change. And we're never going to be, the perfect image that we had of ourselves at 25. What women need to realize is that you will never be as beautiful as you are today, in that very moment, breasts or no breasts. And I think that it's a difficult thing to sometimes process, but I believe that the cancer experience for many women who have other women who have been through it surrounding them, that they can get to that point. And it is, it's very, very important for women to realize that their breasts never defined them before. And if they did before, then it's time to move on from that, because we're women. We're so much more than what we look like. So let's work on some other things. And yes, we want to look beautiful. So let's maybe shake things up a little bit. When your hair grows back, maybe you want to change the color, the cut, or the style. Let's do some different things with your makeup. Let's exercise and feel better about the other parts of our bodies. And women who are part of a couple, I think that the breast cancer couple needs to work on the fact that their breasts should not define the woman, the way that the woman relates to her partner, and the way that intimacy is initiated, and the way that people date and are out there in the world. So, it takes a lot of inner work to get there. But I do believe that it's an opportunity, as traumatic as it can be to lose your breasts. It's an opportunity for women to also begin to see themselves as something much greater than what they look like. And if we can get there, we will be so much better off than we were before we had a mastectomy.
Thank you very much, Dr. Martis. If someone is watching you right now and the person feels hopeless and the person feels like mastectomy has defined her, what message or what kind of encouragement do you have for such a person?
I tell my patients when they find themselves in that hopeless place that they are not going to feel this way forever. We have bad days, we have bad weeks, sometimes we have bad months, but life keeps going. And a breast cancer diagnosis and all the things that go along with it will impact her forever, but it will not always feel so raw, so dark as it does in that moment. And I would urge her to find support and help, to reach out to me or to Paula or to both of us, and to start finding women who have been through this process before them, to actually see women who have gone through this and are in a better place now, I think helps a lot. And it's not hopeless. No matter what, it's not hopeless. Every day that we have on earth is a gift and a blessing. And I think as soon as we believe that, it's easier to kind of start changing the narrative of what's happening. And it's hard. It's a hard ask to say, let's put a positive spin on this, because it's a scary time and women do die. And that is the truth. And that is what women are facing. And to say, let's look at this in a positive light is a hard ask, but we have to, because we don't have any other choice. So we have to do the best we can with what we have and continue to create community and support and programs that help women through those darker days.
Okay. Paula, if someone is watching and the person feels hopeless, what message do you have for that person?
it's a similar message to that of Dr. Montez. You reach out for help. There is a grand community of people who have had breast cancer and who have survived and thrived. And whether it's Evolve Pink or Move Over Breast Cancer or another organization, there's a lot of support out there. So I encourage women to reach out to others who have been through it. And that's really hard for some women to do because they feel sad. They feel like it's a strange thing to talk to other women who have been through a similar thing. But I think that that is extremely important. And I also believe that we need to embrace things like just walking, being outside in nature, spending time with your children, doing activities that you love. Allow breast cancer to be the catalyst for you taking better care of yourself. And that doesn't always just mean eating right. It means taking care of who we are as women and taking care of our relationships. And I need to give a shout out to Dr. Montez, because not every surgeon is as compassionate and caring and able to take the time to really see the woman as a whole person. And that's very, very special, because there are a lot of women who feel traumatized already, and then they go to a surgeon who doesn't make them feel any better about it. And they wind up feeling even more hopeless. So, kudos to Dr. Montez. And there are other surgeons like that out there, but not that many. Surgeons sometimes have a reputation of being, these doctors that work on people who are asleep, and they don't have a great bedside manner, and they're not really treating the whole person. But what Dr. Montez does is heals people. It's not just removing the cancer and, see you later. What she is doing is treating a woman on the inside and the outside and helping her to take those steps that she needs to take to not just survive, but to live a full and happy life as a woman. And that's a very special thing.
We
Thank
love
you,
you,
Paula.
Dr. Motis. Good job.
Oh, I love you guys.
God
And I love
bless
Paula.
you.
I think the work Paula is doing is just absolutely God's work.
Thank
And
you.
I couldn't heal women without people like Paula, who have walked through this, because as much as I can try to understand, I can't really, because I haven't been truly through it. And for Paula to share her experiences, triumphs and dark days with women is really selfless and just such a beautiful thing that she does for women every day, and touches so many lives. So
I agree.
thank you, Paula.
I think it takes a lot of courage to be able to do this, because being in this is very difficult, and being able to come out to help others do this, I think you're doing a good job, Paula. Keep it up.
Thank you.
And good job. We love you too.
Thank
and
you.
we hope to see you both in Ghana.
Oh, I'd love that. I would love it.
We'll bring the van, Paula.
The van, yes.
Can we drive to Ghana?
We'll figure it out.
Yes, we'll figure it out. Yes. Finally, before we go, Dr. Motis, so how has it been like being a doctor, being a surgeon? I mean, diagnosing people every day, talking about diagnosing young people these days. How does it feel like as a woman and as a surgeon? I mean, how does it feel like?
It's hard. I was actually just talking about that with my mom yesterday, that my job some days can be really heavy. And have some really dark days, because not everybody has a great outcome. And it's outside of my control. And when you're a surgeon, like Paula's saying, there's a certain personality that goes into surgery, and you like having control of things and being able to fix things. And there are certain things you just can't fix. And those days are hard. But for the most part, my women, my patients, and men do really well, thankfully. Otherwise, I couldn't do this job. I couldn't do this job if I was losing all my patients, which some doctors do with the diseases that they're treating. And breast cancer thankfully has a lot of research and funding, and we are making strides all the time. The treatment of this disease is changing, honestly, by the year. And we're getting better and better and more targeted and more focused at it. And we're getting better at keeping women alive with less and less treatment, which is, I want to be out of business. I want to just be fishing, And I think every year we are making strides. So yeah, it's tough. There's hard days, but there's also really beautiful days. And I get to meet women and their families and make connections like I have with Paula. And treating this disease has defined me. So in many ways. So it's a gift what I get to do.
Okay. And you mentioned men. Do you have cases of men?
I do have cases of men. It's much more rare in men, but men do have breast tissue. Every human being on earth has breast tissue that can turn into a cancer. So if you do happen, the red flag for women, if a man in your family has had breast cancer, they are much more likely to carry a genetic component than women are.
Okay.
So if there's a man, an uncle, a brother, cousin in your family who's had breast cancer as a male, you should be considering genetic testing.
Wow. But do men do mastectomy too? Men? Have you?
Oh,
Really?
absolutely.
Okay. But I hope they are not in kids, no, not in children, right?
Not in children.
Okay, thank God. Okay. Okay, all right. Before we go, this is my final question. This is a personal question. After mastectomy, does it affect your love life, love making sex? Because, well, in Africa, many people believe that the nipple arouses you in terms of making love, in terms of sex. So imagine you've done mastectomy where there's no breast anymore. How does it affect you? How does it affect your love life, sex life? Does it have anything in connection with that?
We could do a whole webinar on this question.
Oh, wow.
We could talk for, we could do days and days of a seminar on this question.
Oh, then I have to put together that one. Okay.
Yes, it does affect your relationship, not just the physical touch and the ability to become aroused for some women, but also just the way in which she feels in an intimate situation. So it takes, just like everything else with cancer, there's a lot of work that goes into the healing process. And so if you are in a relationship and you're going to have a sexual relationship with someone, or if you've had a long-standing sexual relationship with someone, you need to find new ways to become aroused. And it's not just mastectomy that affects intimacy and sexuality. It's the entire cancer experience, and chemotherapy can affect, the way your pelvic floor functions. Okay. There's vaginal dryness, there's pain associated with intercourse, and there's also, the women are pushed into menopause at an early age. So you may not have already been in menopause, but you're pushed there chemically from chemotherapy. So it can complicate things, and it requires a lot of open communication between partners in order to have a fulfilling sexual relationship for both people, not just for the woman. Okay.
Dr. Montes, do you have any comment about that?
I think, like Paula said, we could have a full weekend seminar on that.
Okay.
Boys, sorry.
It's okay. I understand.
Yeah, we could have a whole weekend seminar on that, because the treatment of breast cancer really does impact everything, psychologically, feeling-wise. Things that we give women affect their vagina and their ability to have intercourse and pain and lubrication and all of those things, which I would love to take a deep delve into that. I would love to have Paula join us for that conversation. Okay. But certainly it's not something that if you have a mastectomy, you're not going to have a sex life. Women with mastectomy have wonderful, flourishing sex lives. Just takes a little bit of work to get there. So I think we should have,
then
that can be.
Yes, we'll put together that seminar so that we can have that as at another day. So Paula, good to have you, and
Thank
Dr.
you.
Martis. It was good having you both. And as you said,
Thank you
we'll
for having me.
put together and see if we can have another one so that you tell me all about the juicy stuff.
The fun stuff.
Okay, it was really good to have you guys. Your final words, Paula. Anything to leave us with? Any message?
Mastectomy does not define you. It should never define who you are. What you look like is not who you are. Your beauty comes from the inside, and your health comes from the way in which we behave and the things that we do in life. So if you're a woman and you have had a mastectomy and you're feeling lost and alone, contact either Evolve Pink or Move Over Breast Cancer or both of us, and together we can find a way to help you feel whole again.
Good stuff. Yes, Dr. Martis, final words?
I will echo everything Paula just said. And Nellie, that question you said resonated with me. If there's anyone out there feeling hopeless, it's not hopeless. No matter what, it's not hopeless.
Okay.
So please reach out, do your self-exams, do your screenings, and we look forward to continuing this collaboration well into the future. And Paula and I hope to see you guys in Ghana one day.
Yes.
See you in Africa.
See you in Africa. I'm sure you're going to have fun, a lot of fun. You're going to enjoy it.
I would love
Trust me.
Thank you. Thank all of you so much.
Thank you so
Bye-bye.
much too. Okay, bye. Thank you.
Thank
Bye.
you. Have a great day.
Bye. You
Evening.
too. Bye.
I am a general surgeon by training, and I specialize in diseases of the breast. I knew very early on in my medical career that the treatment of breast cancer was my true calling and passion. You quickly realize in the treatment of this disease how much this diagnosis affects a woman on many, many levels. Not just her health, but her self-identity, her family, and it's all those moving pieces and components that made me realize not only do I want to treat this disease, but I also want to create something that helps women after their treatment is finished. Women with breast cancer who come to the conclusion of their treatment feel lost because this entire network of healthcare providers and support that were surrounding them has come to an end. That's the piece that Evolve Pink strives to fill, the gap between treatment and the transition into healing, and to give her the tools necessary to transform that into the catalyst for self-empowerment and their greatness. Evolve Pink is bringing women together in a multitude of ways. In-person support group meetup space where women can come, commune, network. In our mobile units, we're going to women so that they don't have to travel far. We are meeting women virtually online so that our reach is global. We have navigators that help women and meet them wherever they are in their journey. We've been offering Reiki, acupuncture, guided meditation, massage, yoga, exercise series, healing arts, guest speakers, nutritional series, book clubs. Every woman can find something that they relate to and will incorporate into their life. And it's those holistic modalities that help women gather themselves back together and feel as whole and complete as possible. Sometimes it's just enough to come to a place and be able to have a cup of coffee with somebody and not necessarily even talk about your experience, but know that they've been there. And to help other women who are new to this process, I want to thank everyone who's contributed to making Evolve Pink a reality and for allowing us the privilege of helping women throughout their breast cancer journey. Without you, we couldn't do what we do, and we thank you for joining us on this mission.